This module will talk about your risk factors for kidney disease. We are going to talk about what do we mean by risk factors and what are your risk factors for kidney disease. Risk factors are things that increase your chances of developing a disease. Some risk factors are non-modifiable, meaning that these are things that cannot be changed, such as your age. Some risk factors are modifiable, meaning that these are things that you can do something about, such as smoking. It is important to identify risk factors. Early identification may either prevent kidney disease or delay the decrease in kidney function. Having a risk factor for kidney disease does not mean that you will definitely get kidney disease. On the other hand, a person can still get kidney disease even if they have no risk factors. However, it is important that if you have risk factors for kidney disease, that these risk factors be identified early, as kidney disease can sometimes be prevented, or if you develop kidney disease, early identification can help you manage the kidney disease better. Risk factors that cannot be changed are also called non-modifiable. These risk factors include age, ethnicity, and family history of kidney disease. The first risk factor that cannot be changed is your age. As we get older, our kidney function decreases simply because the kidneys are getting older too. As the kidneys get older, they do not work as well as they did when we were younger. Age greater than 60 years is considered a risk factor for chronic kidney disease. As people get older, they are also more likely to develop other conditions that can also affect kidney function, such as high blood pressure and diabetes. While we cannot change our aging process, we can try to keep as healthy as possible to decrease the risk of developing other conditions that can affect our kidneys. The second risk factor that cannot be changed is your ethnic background. Why are First Nations, Métis, and Inuit and other ethnic groups at increased risk for chronic kidney disease? Diabetes, which is the leading cause of chronic kidney disease, is more common in First Nations, Métis, and Inuit. High blood pressure is the second leading cause of chronic kidney disease and also appears to be more common. Many experts believe that these ethnic groups have an inherited tendency to develop these diseases. While we cannot change our ethnic background, we can try to reduce the risk of diabetes and high blood pressure by practicing healthy habits. The third risk factor that cannot be changed is your family history. People who have other members of their family that have kidney disease are at a higher risk of developing kidney disease themselves. There are certain kidney diseases that are inherited, such as polycystic kidney disease. This is a disease that causes many cysts to grow in the kidneys. The cysts can grow quite large and squeeze out the normal kidney filters, resulting in kidney damage. Risk factors that can be changed are called modifiable. These risk factors for kidney disease include diabetes, high blood pressure, smoking, being overweight, and taking drugs that cause kidney damage. It is important to know these risk factors that can be changed because early intervention may either prevent kidney disease or slow down kidney disease if you already have kidney disease. The most common cause of chronic kidney disease is diabetes. Having high blood sugars for some time makes the blood like syrup and clogs the blood vessels, including the tiny kidney filters. This leads to scarring of the kidney filters, leading to decreased kidney function and possible kidney failure. High blood pressure is the second most common cause of chronic kidney disease. High blood pressure also causes scarring of the kidney filters, leading to kidney damage and possible kidney failure. Trying to control your blood sugars if you have diabetes and having good control of your blood pressure will limit kidney damage and slower prevent kidney function loss. Smoking, vaping, or chewing tobacco are risk factors for chronic disease. People who smoke have a 2 to 4 times greater chance of developing kidney disease. People who are overweight have a 3 to 4 times greater chance of developing kidney disease, especially if the weight is carried around the belly. Taking drugs that can cause kidney damage can also cause chronic kidney disease. One of the most common groups of drugs that can cause kidney damage are called nonsteroidal anti-inflammatory agents, or NSAIDs. Examples are Advil, ibuprofen, Motrin, Aleve. These can be bought over the counter and, if taken in large amounts and over a long period of time, can damage and scar the kidney filters. Once the kidney filters are damaged, they cannot heal themselves. Sometimes prescription medications may cause kidney damage, so it is important to tell your healthcare provider if you have kidney disease. If you don't know if you have kidney disease, ask your healthcare provider if there is a chance you could have kidney disease, especially if you have one or more of the risk factors for kidney disease. It is important to know about these risk factors that can be changed, because early identification may either prevent kidney disease or slow down kidney disease if you already have kidney disease. In this module, we talked about risk factors, which ones can be changed and which ones cannot be changed. Specifically, we talked about what could be your risk factors for kidney disease. If there is anything more you would like to know, please write down your questions and ask someone on your kidney care team.